I do also want to make note that I am not a medical professional. This isn't medical advice at all. Just want to relate the experiences that I went through and the information that I found as I was preparing to donate myself. So that was it for the first day of appointments. Second day, 8:15 in the morning, needed to arrive for your big GFR test. So this is kind of the granddaddy of urinalysis as I understand it, and understanding your kidney function. GFR, it's the score that you'll see referenced if you're a donor or particularly someone who might need to be receiving a kidney in the future. GFR is the metric of how good your kidneys are doing. They give you a set amount of water that you need to drink along with some pills, and then it measures how well your kidneys filter out that known volume of water with the known chemical. So it's kind of a boring appointment. It takes a few hours, and then you have to like pee at certain intervals, but it's not complicated by any means. It does say, what was it? You do not need to fast for the test. If you take a diuretic, which I actually do every day, I'm on spironolactone for acne of all things. If you take them, you want to tell them that ahead of time, and I believe that I just took it after the test instead of early in the morning like I usually do. And it says you should stop all non-steroidal anti-inflammatory pain or full-strength aspirin or any combination of such with a full 3 days before this GFR test. So this is again what I'm reading from what they sent me, something to ask about or keep in mind if you're going in for a GFR yourself. Again, I met after that with the social worker just to check in again, and again with the transplant coordinator. Some of these were even like just seeing how you're doing, I think getting a gauge on if you've changed your mind or if you've been made uncomfortable by some of the testing that they're doing. Meet with an insurance specialist at 12:45, which is super straightforward. If you are donating a kidney in the United States, you do not have to show your insurance card to anybody. All this testing is provided for by your recipient's insurance. Even if you're a non-directed donor and haven't been assigned a recipient yet, and no one should even ask for your insurance card. If they do, simply say, I'm a kidney donor and was told that I shouldn't have to pay. That cleared up any initial confusion when like a receptionist would ask me for my card. 1 o'clock, I went to urology. Again, this was another meeting with a surgeon. It says yet another urine sample. I don't really remember how many I gave. What is it? The big GFR, and those results came in. Then I met again with the surgeon early in that afternoon. He, I think, is just giving you an overview of your kidney function, what your CT scans look like, and also like following up on blood work and just overall, are you looking like a medically fit candidate? Also getting a gauge again for whether you're of sound mind and you know, your kind of personal opinions on donating and what brought you into it, that kind of thing. So it was 2 o'clock on the second day, so almost my last appointment that was scheduled for my psychiatric evaluation. This was the one that made me most scared, not because I was worried about my like mental state, but because it felt like the one test that I could blow myself. Not something that, you know, your blood work doesn't pan out, your kidneys don't look right, all sorts of things can disqualify you, but most of them are things that are outside of your control, whereas it felt like if I walked into the psychiatric exam and just was too nervous or froze up, like I could disqualify myself just out of not being prepared. So since the schedule was sent out, you know, a couple weeks before, I did all that I could to research the psychiatrist that was going to be evaluating me, found any YouTube videos that had her speaking, read quite a bit of her research. I read the book, The Fear Factor by Abigail Marsh, which talked about the mentality that causes people to donate their kidneys altruistically or in a non-directed way. I was really, really pretty prepared. Luckily, it wasn't half as intense as I thought it would be. probably half of it is just simple cognitive functions. Do you know where you are? Do you know what county you're in? Do you know who the president is? Along with, can you memorize 3 words and recite them later on? Can you draw can you like replicate a drawing that she made on the paper? That kind of basic stuff. Mixed in then with a conversation about your motivations, a bit about your past history, you know, and just kind of who you are as a person and where you're, you know, does this line up with consistent morals? How do you make decisions in your life, and which ones do you regret, which ones don't you? And so it really wasn't intense. It was easy to talk about. After that, you know, I was so worked up, but finally got clear, really relieved, and then had a quick like dermatology appointment. They just scan your skin to, you know, make sure you don't have any funky spots. So it's a really busy couple days that you're running to all these appointments, and, you know, I kept my, you know, couple books with me. I had a notebook and, you know, your phone, you're running all over, keeping track of where you're going in the hospital and, you know, whether you're late for your next appointment and all this. And up until that point, I'd never met someone, to my knowledge, that was experiencing kidney failure. And it's one of the catch-22s I've realized about organ donation, that people that are qualified to donate may not have really been exposed to the need for organ transplants because no one in their family has had struggles with kidney disease. And the people that have family members that struggle with kidney disease are oftentimes not qualified to donate because they may be predisposed genetically to some of the same syndromes. So you know, that's kind of some backstory to me running around the campus, like being all professional and ready for my next appointment, carrying my notebook everywhere that I kept any questions written in. And I was waiting in line at the nephrology center, and there was a man in front of me in a wheelchair waiting in line, and the nurse had, like, whatever family member was with him was trying to help him get up to talk to the nurse about something. He needed to stand, and just watching, I couldn't even see his face, but I could see his like elbow as he braced himself on the counter to try to stand up, and it like snapped me out of this kind of business mode, and just watching his like shaking arm of a man who clearly lost weight far too quickly, was clearly much more ill than he used to be. I lost it. I had actually run to like the lobby bathroom and forego my spot in line because it was the first time that really the gravity of what everyone in that lobby was going through was experiencing, and the efforts of these medical professionals that have worked collaboratively over decades to get to the point where we can treat people in dialysis and even provide something as unbelievably human as organ transplants. And that was kind of the one time that was overwhelming in and kind of, I guess, a positive way, because I was glad that I was able to participate in some helpful way. But it was, I think, a monumental experience for me in this kind of timeline of going through everything. It was actually more emotional than even meeting my recipient later on, believe it or not. So just wanted to share that little tidbit too. So I got through those 2 pretty intensive days on August 1st and 2nd. I remember the 2nd was a Friday, and then on the 6th I sent out my surgery preference calendar. I just took a 2019 calendar and color-coded all the dates that were appropriate. Really, I was just trying to avoid my cousin's wedding, in which I was a bridesmaid. That was October 5th. And then I also didn't want to get too deep into winter because I knew that you'd be walking a lot in recovery, and so I wanted to be able to walk outside instead of at the gym. And so we scheduled for August 8th. Again, that very same day that I sent out that email, which was right after that 2-day testing schedule. August 6th, again, get the final test results. I guess got to the Cleveland Clinic, and so that's where I could see on that My Chart app that all the test results had been completed. course, I'm checking my email and that my chart constantly to hear August 9th, which was 1 week after that, the last day of those appointments. August 9th, I knew that the committee was reviewing it, so I was just at my phone all of the afternoon of August 9th, but I didn't hear anything until August 12th. Got a call back from the coordinator saying that I was medically approved, and that was amazing. It was really telling at that point how badly I wanted to be approved. That's a good sign, right? That you really want to do this. In between August 12th and August 21st, when I got a call that I had been matched to a 10-year-old pediatric patient that they had, I hadn't, the thought that a pediatric patient could even be considered, that there were children in need of kidneys, it really didn't even cross my mind through this whole thing. I kept thinking about that man that I'd seen at the lobby, but I was just blown away that, I don't know, that really changed a lot for me in a way, and it made it much easier for me to decide that I didn't want to necessarily stay anonymous. So when you're a non-directed donor, you can choose to say anonymous, which means they will never figure out your information. If you agree to not be anonymous and you're open to contact, the other party, of course, also needs to be open to contact. And they warned me ahead of time to make sure that I'm thinking, like, that if you put yourself in the recipient's shoes, what a difficult thing for some personalities to thank another person for, and to try to understand why a recipient wouldn't be open to contact. So I was really on the fence about whether I wanted to stay anonymous or not, up until I found out that there was that I might be donating to a child, because in my mind, you've got a child, their worried family, and this, the child has to deal with their own medical issues, but then it's also such a problem or not a problem, but it's a situation that overwhelms an entire family. And I felt that if I was open to communication with that family, then it could alleviate some of the emotional tension that a parent or caretaker may feel towards a child that's going through such a tumultuous experience. And I'd be able to kind of reassure anybody involved that there's no angel coming down from heaven. There's no just that I felt like if I were a parent, that would be the kind of thing that I would want the opportunity to be able to communicate with that person, and understand who it is that that my child has benefited from. At least that was kind of parts of my thinking.